Welcome to the Mind Myself podcast. I'm Esther, and it is my pleasure to be bringing you information about healthcare approaches, health issues, and people's health journey stories, all from the complementary, holistic, and integrative perspectives, helping you become your own best health advocate and helping you make your own informed choices because you matter. Welcome to Mind Myself Conversations with E. I'm Esther, founder and CEO of Mind Myself, and it is my great pleasure to introduce our guest today, and she's going to tell you a bit about herself, Dr. Vicky. Dr. Vicky, welcome.
Thank you, Esther. It's a pleasure to be here.
Fantastic. I so love having conversations with you. So let's see where this conversation today takes us. But before we jump in, tell us a little bit about yourself, your credentials, your career, and the overarching theme of what we're talking about today.
Well, in a nutshell, I'm a retired wellness doctor, originally certified as OB-GYN, but I added complementary alternative medicine, regenerative medicine, and energy medicine to my practice to become a one-stop shop. So what I wanted was the one place for women and men to be able to come and learn about their wellness. So that was really what my focus was and what my practice was all about. I realized women do not have any idea what the science behind how their body works was explained to them. So I actually had all of that information in their labs that I was doing for them. So I started writing books about what hormone levels should be in an age-appropriate manner for my patients.
Wonderful. And so I know we have recorded a number of podcasts with you about these kinds of topics. So if you're listening to this one, there's a lot more. And today we're going to talk about part one of one leg of the hormone chair. Can you give us a brief overview of the four legs, and then we'll dive into this one?
Absolutely. Well, and thank you for asking. You know, my premise when I talked with patients was the foundation of their health is their hormone chair. So think of the four legs that comprise a chair. And those four hormone groups are the four legs, the foundation of your health. First leg is your female male hormones. For men, just your male hormones. The second is your thyroid. The third is your adrenal cortisol, because who doesn't have stress? And your fourth leg is your insulin. So not your blood sugar, not your A1C, but your insulin. So those are the four legs of your chair, and they have to be not only healthy, but balanced. And if they're not, you may sit on a chair with a broken leg, realize you're sitting on the floor, meaning you don't feel good and you don't know how you got there. So you have to have balance in your hormones.
I love it. And we don't hear about this very often. So I'm thrilled that we are having this conversation, and it relates to all aspects of our health, these four hormone legs. And before we get into the first leg, I noticed that you have something on your forehead. We're recording today on Ash Wednesday. Tell us just a brief thing about what that is.
Well, in the Catholic faith, what it means is that you are dust, and unto dust you shall return. So it is the season of Lent starting today, and it is a reminder that we need to be prepared for the coming of our Lord. And that is the beginning of Lent. So that is our physical reminder, is that we are dust.
Okay. I didn't actually know that. Thank you very much. Right. So the first leg of this hormone chair, what is it? And I know there are two parts. So what's the first part? What's the second part? And then let's talk about part one.
Well, the first leg of your chair is your sex hormones. And when people say hormone, that's usually what they think of is their sex hormones. So for women, we actually have male and female sex hormones. And sometimes the male is more predominant than the female. Oh, dear. And that can be a lifelong issue because it throws your entire body out of balance from puberty onward, even through menopause, believe it or not, and beyond. So men only have male hormone to deal with. But in the world of women's health, it is your estradiol and progesterone for your female hormones. That is what comprises our menstrual cycle. Most women have about once a month cycling every 28 to 30 days. Again, there are some women who are genetically unlucky enough that they have a polycystic ovary condition where they have more male than female. But know that menopause is also a condition where we're more male than female because we lose the functioning of our ovaries. But the symptoms that go along with what estradiol will support, the symptoms in body areas that go along with what progesterone supports, both of those can be complementary yet different. What do I mean by that? Well, estradiol is one of those hormones that impacts every system from head to toe. So it is your skin, it's your hair, it's your muscles, it's your joints, it's migraine headaches, it's how your bladder works, it's how your GI tract works. And you go, oh my goodness, it's everything. Yes, it's everything. Your progesterone, you only make in the second 2 weeks of your cycle. It stabilizes the lining that your estradiol builds, but it's primarily working on your moods, your emotionality. So it's very central nervous system oriented. It's very GI tract oriented with the speed through which things travel through your gut. So bloating if things go through slowly, or constipation, but also very, very tied to breast health and breast tenderness. So estradiol and progesterone need to be balanced. If you are estrogen dominant, that is unfortunately going to cause issues that are endometriosis or abnormal heavy bleeding or irregular bleeding or polyps inside the uterus, things, fibroids, which are extra growths on a uterus. These are all things that, if left to go long enough, can also, in estrogen dominant situation, cause bad mammograms and even contribute to breast cancer.
Wow. So we're talking estradiol, progesterone. Now, can you talk about the testosterone, the two kinds of testosterone, even in women and in men?
Both types are important, the total and the free testosterone. So when I check levels in the office, it's a must to check total and free for women, total and free for men. What is total? It's the reserve. It's everything that your body has waiting to, quote unquote, be tapped. The free testosterone is what you pull from your reserve to use as your bioavailable, I need it right now, testosterone. So if you have a testosterone that is your bioavailable is what is age appropriate for women, approximately a 10th to 15th percentile, that's normal. What if your level bioavailable is actually higher than that, more in the 20, 30, 40, 70%? That's that condition I talked about that may actually be genetic polycystic ovary. And in men, it's the same deal. The reserve is your total testosterone. What you pull out and use is the free. So knowing that there are times you may pull so much from your reserve that you have bled your reserve dry and you have very little free testosterone left, that's like a train on a downward track that the brakes just went out and you're heading for a big time crash.
And that's for both men and women.
Correct, but mostly men. So with women, our big time crash is when we go through menopause. And men, if you think about the fact that women make hormone from age 12, puberty, to age 50 and a half, which is the average age of menopause, then it's a bell curve. Now, there are variations to the theme of that bell curve, but that bell curve is basically the age appropriate amount that you make of female hormone. if you have either premature menopause, or if you have very wild swings, even in your 40s as you wind down, or in your adolescence as you wind up, there may be times in those wild swings that you may go from 15th percentile one month to 80th percentile the next, but it's downward trajectory in your 40s, or its upward trajectory in your adolescence, is going to give you a pretty wild change in symptoms if you're going between 15th and 80th percentile.
So I'm hearing you say everybody needs to pay attention to their hormones and they need to get testing. When does that start? When is the optimal time to start?
In my world, the optimal time is adolescence, because endometriosis, fibroids, polyps, abnormal bleeding, all of these conditions can start as early as adolescence. Believe it or not, polycystic ovary, because it's genetic, is also starting, but it's just gearing up. So the mild polycystic ovary patient won't really notice much of anything. They may not start showing symptoms until they're in their mid-20s or even late 20s. The moderate polycystic ovary a little sooner. The severe polycystic ovary patient may actually show symptoms as early as in their adolescent years, but nobody is checking levels. So they're simply told, oh, you have irregular periods. Oh, and you're having a weight gain problem. Well, it must be lifestyle. There must be something you're doing wrong. And where is the science in that statement? That's a judgment. That isn't science-based. So we shame girls into thinking they are doing something wrong. They are damaged, when medicine is simply not taking the time to look.
Wow. And so if somebody starts early looking at their hormones, whether it's a young woman or a young man or somebody in whatever gender they happen to be exploring at the moment, but for the purposes of this, what are the symptoms if their hormones are too low, like low estradiol? What does that look like?
Well, again, it's going to look like a menopausal woman. They may actually have hot flashes and sweats and think that it's just some sort of blood pressure irregularity, or they took the stairs too fast. You know, they're not going to think hot flash because nobody's told them this could be hormonal. By the same token, they may have an onset of migraines. They may have insomnia. They may actually have muscle aches that seem out of proportion to the exercise that they're doing. So it's similar to a menopausal woman, but nobody puts menopausal symptoms to somebody who may be in their teens or 20s or 30s.
And is that, before we move on to the progesterone symptoms, is that what somebody's going through if they're, say, in their mid-30s, mid to late 30s, and they're starting early onset menopause, or whatever you call it?
Absolutely. In fact, I've even seen women who came to my office that were told they were in premature menopause. I checked levels, started them on hormone, and lo and behold, their periods returned and their levels, their ovaries started working again. Their levels went back to age appropriate, which meant they had a trauma to their body that shocked their ovaries from working. Putting them back on hormone replacement actually brought ovarian function back to their body. So this one particular patient, she said to me, well, this is good news, right? I said, well, it's good news and bad news. The good news is your ovaries are working again. Yay. I said, the bad news is you have to go through menopause all over again. And she went, oh.
And maybe there's some help from it, but that'll be another episode. So what are the symptoms of low progesterone?
Primarily that PMS stuff, moody, crying even if somebody just looks at you wrong, and getting angry, and then being sad, being angry, being sad, having just changing emotions that you have really no control over. And when it gets really extreme, there are many women that feel that they are up here watching their reaction over here. And many people actually call that a PMDD, where it is a premenstrual dysphoric disorder. And in some cases, they're actually placed on psych meds, which that's not the issue. The issue is low progesterone. And I'll share with you that low progesterone is, is something that affects your GI tract, as I mentioned. It can affect migraine, headaches, breast tenderness. But in particular, if a woman is pregnant and doesn't have adequate progesterone, she's going to miscarry. And it isn't her fault. And she might have worked really hard. This might have been a prized time or a difficult process of trying to get pregnant. But if nobody's checking her progesterone levels, she may miscarry a perfectly healthy pregnancy.
So sad. And there are so many women experiencing that. I know this. So there's just so much to talk about. What about low testosterone for women in this kind of scenario? What does that
look
like?
Low testosterone is usually not so much the issue as a high testosterone. So excess testosterone is that patient that has acne. And no matter what they do, they cannot clear it. And they're shamed into thinking, oh, you must be eating too many sweets, or, oh, you must not have the right facial washing, regimen figured out. Oh, we're going to send you to the dermatologist because obviously you're doing something wrong. And the unfortunate thing is nobody's checking their testosterone levels. So could it even be a condition like rosacea, which is more blood supply per square inch to the face? That's going to have a warmer skin temperature, which lets different bacteria live in the skin than somebody with a normal skin temperature, which is going to make people prone to acne. So things that are like hair loss to your head, that is actually excess testosterone. Excess hair to their chin, to their upper lip. There are women that would walk into my office telling me they shave every day. Well, wait a minute. That's not what we're supposed to have at all. Women who have mid-abdominal weight gain, and it's not their overeating or lifestyle change, it's actually a higher testosterone than a female hormone of estradiol progesterone. Where do men put their weight on? In their belly. Guess where women with excess testosterone are putting their excess weight on? In their belly. It's not their fault, but they need to know that.
Absolutely. And what does high estradiol and high progesterone look like for a woman?
Well, most women will not get a high progesterone unless they're taking progesterone. That is actually only after we ovulate. And so there are many women that don't regularly ovulate. They will therefore, by definition, only make female estradiol with very little progesterone. That is an estrogen dominant situation. That's like having too much of a good thing. So you then in those kind of cases can grow polyps and excess bleeding. You can have fibroids, you can have endometriosis, you can actually hyperstimulate a breast into breast cystic disease, into an abnormal mammogram, and over time into breast cancer, uterine cancer, even ovarian cancer.
So many things to know. If somebody who is still a menstruating woman and says, well, yeah, but I'm menstruating and my periods are okay. If somebody's not having huge problems with their periods, doesn't that indicate that my hormone levels are fine?
Well, not necessarily. It's like saying, gee, my car is running fine. Does that mean I don't have to pay attention to the gas gauge? Well, of course you do, because all of a sudden you're going to be on your way someplace and you run out of gas. So nobody wants to be surprised about their health. Nobody wants a surprise diagnosis that they didn't expect and don't want. like a cancer, or you have endometriosis, you need surgery, or you're infertile, and this is going to cost you $10,000 a cycle to work with a specialist to try to get pregnant. That's not the time that you want to find out you may have an issue. So preventive maintenance, we do it on our car, we don't do it on our body. So what's wrong with knowing how your body works instead of just covering it up and saying, well, my periods are good enough. Oh, I only take pain medication once in a while. Oh, well, I know that my mom had issues with this and that and the other, but that's not me. I'm doing more lifestyle things to keep myself healthy than my family did. Well, that all sounds good, but until you know, you don't know where your levels are. So do your preventive maintenance on your own health and know where your body is and know what some of the trouble signs are that may start showing up.
Let's get really practical. What are the tests that somebody should ask their doctor for to check on these hormones?
Well, I write books about that, and the last chapter in each of the books is actually how to talk to your doctor. So what are those female male hormone tests? Again, estradiol, progesterone, total testosterone, free testosterone. So you need the 2 female, the 2 male. Those 4 tests, if your doctor will not draw them, then know that you can order your own blood tests. You can go online to either Quest or Life Extensions, life as in life versus death, Life Extensions, which is a subsidiary of LabCorp. Both of these are very large labs that have a coast-to-coast covering, and they have draw stations. So you can go online, order your own labs, pay for them online, that they send you a receipt with proof of purchase. You can now take that proof of purchase receipt with you to a draw station, get drawn, and then they will ask you, where do you want your labs sent? You know what your answer is? You want them sent back to you because you want control of your numbers, your labs, who looks at them, who doesn't. If you send them to only one place, they have them and you don't. You want control of your labs.
Absolutely. And you're in the United States. In Canada, I believe it would be Life Labs. And I know that I have paid for some extra lab tests, blood tests that I have wanted in the past. So I'm assuming we can get these done as well.
Mm-hmm.
What can it mean in general? We've talked about how that affects our monthly cycles as women and men's testosterone production, but how does it impact our overall health if our hormones are out of balance?
Well, again, think of it as one leg of that 4-legged chair. So if that leg is broken and you're sitting on a chair with a broken leg, what happens? Boom, you're on the floor and you don't even know how you got there. So you dutifully rewrite your chair, dust yourself off, sit back on the same chair. Well, that's the definition of insanity, doing the same thing, but expecting a different result. So you may then go to your doctor and say, I don't feel good. And most doctors have no idea what hormone imbalance is all about because it isn't taught in medical schools. So they simply look at you like, oh, well, we'll do the usual battery of tests, which guess what? Doesn't include any of your 4 hormone groups. So they're going to tell you your blood work looks fine. But doc, I don't feel good. Well, all your blood work is good, so get out of my office. And you will be dismissed. So take charge of your health. Take charge of your female hormone, male hormone. Know where you are, do your preventive maintenance. And if you have questions, realize that there are books out there that can help you, because that's my mission, is to make sure every woman knows her body. I empower you to know what your body is telling you.
We will put the titles of your books and the links into the notes that accompany this recording for sure. And because, Dr. Vicky, you are retired, people cannot reach out to you and do a consult anymore. If they buy your books, and they say, great, now I'm armed. And where do I go if my doctor is not open to this conversation? What to do next?
I still want you, and I encourage you to contact me, because I will still give you a heads up as to what this looks like and what you need to do from this point forward. And I will even help you find somebody that can help you with any scripts you may need or any other more intense help that you may need.
And is that only for people in the US, or can you do this?
No, that goes for Canada as well.
Okay, fantastic. What if somebody is elsewhere and not in North America?
Email is ubiquitous. Okay. Email reaches us all, no matter where we are.
Okay, I love it. I'm glad we got that clear, and we will make sure that your contact information is super clear in the notes. Dr. Vicki, what would you like to leave your listener with today?
Is you deserve to know how your body works. So everybody is told, oh, you have irregular periods, we'll just cover that up with the pill. Challenge that statement, because covering something up is simply leaving a mess for later to figure out what's going on. You need to know how your body works, do the homework, do the preventive maintenance. You need to know how you work. Don't trust somebody else with your health. Learn what makes you tick, how you work.
I love that. Thank you so much for being here and for sharing your incredible experience and knowledge with us, Dr. Vicki.
You are more than welcome.
Thank you for being with us at the Mind Myself podcast today. We know that time is precious, and you've spent some of your valuable time with us. We're grateful. If you would like to reach out to our guest directly, the information is below. And if you would like more from Mind Myself, that information is also below. Please visit our website and check out all the information about the different complementary, holistic, and integrative healthcare approaches, information about health issues, more podcasts, tons of blogs, and we even have a community page for you where you could reach out and tell your story safely, or you could ask questions, and perhaps somebody else in the world is going through something similar to you. In any case, we're so glad you're with us, and we're doing this because you matter.